Today we will be discussing about how to diagnose endometrial cancer and do further workup before proceeding to treatment. When the patient presents with abnormal uterine bleeding, the description of which already given in our previous clinic, then we take proper medical history and do pelvic examination. First routine test routinely done is transvaginal sonography, which measures the endometrial thickness or any other lesion in the endometrium. Then we go for biopsy, which can be either done in office-based blind biopsy or under hysteroscopic guidance or dilatation and curettage. Office biopsy sensitivity is 90%. It can be improved if done under hysteroscopic guidance. If office biopsy is non-diagnostic, then we go for dilatation and curettage with hysteroscopy, which will be confirmatory in most of the cases. In some cases, we directly go with the dilatation and curettage and hysteroscopy, especially where the office biopsy is not feasible or patient is having heavy bleeding, in which DNC will not only give a better diagnosis, but also can stop the bleeding or patient with high chances of cancer. In case of benign diagnosis, the evaluation should be done after 3 months, especially in patients who have persistent uterine bleeding or high-risk patients. Imaging is done to know the local extent and to rule out metastasis. MRI is better to know the local extent of the tumor. For metastasis in low-grade cancer, chest X-ray is done, and if it shows any abnormality, then only CT scan chest is done. In high-grade cancer or type 2 cancer, CT chest, abdomen, and pelvis is done, or PET CT, whichever is available can be done. In cases of fertility sparing treatment, we should always do an MRI to know the local extent of the tumor, because to understand whether this patient is fit for fertility preservation or not. CA-125 is always done, and if it is raised in pre of period, then it can be used for follow-up in low-grade cancers. But in high-grade cancer, this is also done to know whether there is any metastasis, because high level of CA-125 in high-grade cancer is associated with metastatic diseases. So these are some basic investigation, and now further molecular clarification is done, which I will be discussing in future clinics. Thanks.